Thanks, Dr. C, for taking time to chat with us today. Can you give us an overview right now on the current coronavirus outbreak situation in San Antonio?
Absolutely. So we've had 69 cases that have tested, 69 cases of positive tests. So 69 people have come back with a positive test so far in San Antonio. Unfortunately, we've had our first death that was confirmed due to COVID-19. So that's the current lay of the land. Of course, we don't have mass testing. Testing is very selective, as it is everyone right now. So what we do know is that cases are increasing, but as yet we don't know the degree of exposure that people are having because we don't have accurate numbers. It's impossible to know who has corona right now and who doesn't. So all we can do is put safety first. And so that's become the number one priority. It has been now for many, many weeks, as you know. We've certainly upped the precautionary measures for everyone over time. Now we are really very rigorous in terms of screening people before before a visit to the office, and quite frankly, because so many people are carriers of the virus potentially without having symptoms, we've decided to go to almost exclusively a telehealth model. So the only patients we are now seeing in person in the office are the ones who have just been diagnosed with breast cancer and who need a plan. Those people are also, unfortunately, anyone with a breast cancer diagnosis is obviously at higher risk of developing severe symptoms if they contract coronavirus. So we've gone really we've gone full Wuhan, that's the term everyone's using in terms of precaution, as close to it as possible. So masks, gloves, we're disinfecting with antivirals between any traffic in the office. So any new person comes to the office, we're disinfecting everything with antivirals. If a patient is seen, that room is bottom again, disinfected before anyone else is allowed to come in. Now, obviously, with the traffic, with the such little traffic through the office, it's very easy to do that because we aren't seeing very many patients in person anymore. So,
screening process. Can you explain to the viewers what our screening process is currently for patients coming into the office?
Yeah, so all our protocols are based on CDC guidelines and then also local authority guidelines, plus the different hospital systems that we have in town. We're using their guidelines too. So what's interesting to see is that there's quite a spread of recommendations across all the guidelines, and also you're going to start seeing some recommendations being relaxed because of we're running out of supplies as a health system. That situation is getting really, really very critical in many parts of the country. So there's a big push, and rightly so. We've all got to maximize our personal protective equipment for our frontline folks. So when it comes to creating a guideline or a protocol for the office, there is still some leeway in terms of what we follow. So we have decided to follow the most aggressive. Whenever there are guidelines that don't jive, we've picked what we consider to be the absolute safest and most aggressive. So if anyone, in terms of the screening questions, everyone is screened over the phone. We don't screen in person. They don't turn up to the office to be screened. That defeats the purpose. So everyone is screened ahead of time. Symptoms, fever especially, exposure, whether they've had any travel, where they've been, who they've been in contact with, if any of their circle has been placed in quarantine or isolation, and obviously if they've been exposed to someone who's had a positive test. These are all things we talk about, which are actually a lot more stringent than a lot of places are using. So that's the screening. Also in the hospital, we have, we're down to bare bones in terms of the cases that we're doing. Most places in the country have had governors come out and really put an end to elective cases. So in terms of the procedures we do, we're obviously not doing very much right now. But we're still operating. Some patients still need surgery, and we have to also protect them as much as possible. So masks, gloves, distance at all times, as much as possible. Our team, because obviously our team has to be protected. We're still in the ORs and still potentially exposing our team to the virus. So we're really careful there with as much distancing as possible. During intubation, during general anesthesia, when the anesthesiologist is placing the tube in the patient, the breathing tube, and also when that tube is being removed, potentially that's a source of spread of the virus because it's aerosolized. So typically in the past, a lot of the surgical team would still be in the room doing things, getting things done to facilitate, move things along, while the anesthesiologist was either placing the breathing tube at the beginning or before surgery, and also removing the tube at the very end. So now, we're not even in the room when that part of the case is going to be happening. So that's a fairly new development. We're trying really to think of everything to limit exposure and limit spread. So, and it's impossible to know whether it helps or not without knowing who's infected and who's asymptomatic. And obviously anyone who's got symptoms now, even if they need surgery, if you've got symptoms, you're going to have to delay as much as possible, right? So that's come up. It's like, what if there's a breast cancer patient who's got an aggressive cancer who needs a lumpectomy or mastectomy, but they've got a fever? What do? Well, the last thing you want as someone who's got the coronavirus is to end up on a ventilator for days and potentially risk your life over a procedure which, the patient considers the lumpectomy or mastectomy for breast cancer obviously extremely urgent. But in reality, if you're in a situation where you've tested positive for the virus and you're looking at one of those procedures, you try and be patient. It's exceptionally emotional, but some of our patients will be put in that position, unfortunately, and you do have a couple of weeks, to delay your lumpectomy in that situation, or more. There are plenty of patients. I mean, if you forget coronavirus for a sec, which I wish we all could, but if you forget coronavirus and you look at just the standard kind of situation as a patient is diagnosed and then goes through the system and to get their surgery, really, we always try to limit the wait between being diagnosed and then getting the surgery you need. We try and limit that to less than 6 weeks as much as possible. But what I'm saying is, there's always a delay in getting your surgery. It's never instantaneous. From the second you get the biopsy result, you don't go into surgery the next day. There's always a delay. And that little delay doesn't impact your prognosis, doesn't impact your outcome. So if one of your doctors, whoever sees this video, is concerned and you're waiting for a test to see if you've got COVID-19, unfortunately, that's something that really has to be factored in, and they're going to want to delay your surgery because the virus attacks the lungs primarily. It affects other parts of your body too, obviously, but primarily it's the lung issue. The people who are dying because of that. So if you expose someone to the virus and then you expose them to a general anesthetic and a surgery, it does not bode well. That's not going to be a good combination. Extremely risky. So that's the state of affairs right now.
You made a good point with that. For those who either are facing breast cancer surgery or are looking at breast reconstruction options following their breast cancer surgery, that are having to delay or maybe choosing to delay, what options is PRMA providing right now to at least be able to start the process of working towards making a surgery decision for breast reconstruction?
Yeah. So hopefully, a lot of people right now are just sitting at home twiddling their thumbs. So now's the perfect time to get all your options together, start thinking what you want to do. Obviously, I'm talking about especially people who aren't in current treatment, who are just, everything's done. And so I'm talking first and foremost about the delayed folks, people who have had all their breast cancer treatment and there's no rush. Now is a really good time to get your options together. We encourage people to get in touch, irrespective of where you decide to have your surgery. Now's a really good time to get your options together. We can Skype, we can FaceTime, and insurance is covering it now. Many insurance plans are now covering telehealth, so that makes it even easier for folks for that entire process. So for delayeds, it's an ideal time to look into your options. For patients with a breast cancer diagnosis, an active one, a current one, waiting for treatment, we've had, unfortunately, we were caught in a position where we had patients scheduled traveling to San Antonio for their mastectomies and immediate reconstruction. And unfortunately, we've had to cancel those patients and have them get their treatment at home, or their breast cancer treatment at home right now. There are going to be some parts of the country where if you're having a mastectomy for breast cancer right now, they will still allow you to have a tissue expander placed. So you could, in some places, have a skin sparing or nipple sparing mastectomy and put just a temporary expander in place just to maintain the skin envelope, and then you can have your surgery, your definitive surgery, delayed whenever this mess clears up. I have to say, there are going to be many places, and over time, probably next couple of weeks or so, the places that will consider that an absolute no-no the list is going to be growing, right? So this has to be balanced with the PPE shortage, and if the measures that have been put in place over the last few days with maximizing production, increasing production, if that problem goes away, then great. But right now, it's going to be, I think, very tough for people to get even a tissue expander in some parts of the country. So please, I know it's far from ideal, but unfortunately, that's the lay of the land right now. So we're not in a position right now to be scheduling patients from out of state to come for in-person visits or to have their surgery scheduled. So we do encourage you to reach out. We obviously have a lot more time now. We're available for conversations, for consults, for visits. Call them whatever you want. Answer your questions, whatever. We're available over Skype and FaceTime. So we're here.
And then just to kind of, wrap our video up, what steps can patients, and everyone for that matter, be taking right now to help flatten the curve, as they're saying, and reduce their risk of catching the disease and also transmitting the disease?
Yeah, so you got the OCD about washing your hands. So good news is that you wash your hands with warm water, warm soapy water. Just regular soap will do it. Good news is you do that for 20 seconds, pick a song, sing a song, happy birthday song, whatever, your favorite song, just sing it, wash your hands, and then you gotta do a surgical. You want to do a little demo of a surgical hand washing? Okay, so you soap up your hands, warm water, and then start with your thumb. Okay, you've gotta get all the way around each digit. Okay, all the way around each digit with the soapy water. You scrub. Take your ring off. That's irresponsible. Take your ring off right there. Scrub. All right, and then you swap hands. Scrub. Each finger. Scrub all the way around. So you got to go all the way around several times. Then, in between the web spaces, get one hand on top of the other, rub, web spaces, swap, rub, web spaces, all the way around again, and then down the wrist, and then the other side, down the wrist, and then scrub. So that is a lot more than most people do. That's a quick surgical scrub right there. So when we prepare for surgery, it's more extensive than that, and it's a lot more than 20 seconds. But that's what we do essentially multiple times. You've got to get around each digit. You've got to get inside between the web spaces, and you've got to go down to the wrist. We go down to the elbow. Mm-hmm. But for the average person just washing their hands in the kitchen after going outside doing whatever, if you go down to the wrist, that's fine. But so that's really crucial. You should run out. You should lose track of how many times you're washing your hands a day.
Yeah.
And then and there's a run on. Obviously, there's a shortage of Purell and other sanitizers. So. Even if you haven't touched anything and washed your hands, you haven't washed your hands in a little while, you haven't touched anything, you know what? Take a squirt, get a squirt of, whatever. Clean up your surfaces in your kitchen. You go outside, you touch stuff. The virus does hang around on certain surfaces for up to 72 hours. Some reports saying up to 9 days, but the studies I've seen showed 72 hours. So doesn't last that long on certain metallic surfaces, but it lasts on cardboard for a few hours, plastic, so think, if you touch something, doorknobs, if you go out in public and you open a door, okay, you have to presume you just touched a dirty doorknob, okay? So that's why the other measure is keep your hands away from your face, because unless you've been stuck indoors all day in your own home, you need to presume that you've been exposed. So you start touching your mouth, your nose, your eyes. After opening up a door in public, you are now potentially introducing the virus to your system. It gets in through your mouth, through your nose, through your eyes. So keep your hands off your face. The next thing, you have to be really unsociable. Okay? I'm European. I don't have personal space issues. Some people have a constant bubble around them and they don't like people standing next to them, right? I'm not like that. I'm Mediterranean. Okay, it's like it's I touch people. So I get it, but 6 feet. Okay, in Europe, 2 meters, right? 6 feet. Stay away from people. That doesn't mean you have to be unsociable. You know what? I mean, stand outside your door. Talk to your neighbors. Okay, so you have to shout, but that's okay. Just stay away from people as much as you can, right? You have to go to the grocery store, pick up stuff. You have to go to the pharmacy, get your meds, all that kind of stuff. I get it. You have to do it, but if there's a crowd, just stand back, wait. And some people are going to be inconsiderate. The other day, my wife was telling me she went to try and find some milk, and there were 2 people just standing in front of the milk fridge in the store, just having a chat. And my wife was just standing there. She's 6 feet away, just waiting for them to finish their chat because they realized they were in the way. And because of social distancing, they were blocking everyone's access to the milk. But, I mean, it's a change. I get it. Just be patient. But don't get aggravated and then just go for the milk anyway. Just wait. Just be patient, right? So yeah, social distancing, hand washing, keep your hands off your face. Those are the big ticket items, and really try and encourage everyone to do the same. So social distancing works. It breaks the cycle, and then it doesn't mean the virus will all go away in a week, but what that does is it slows down the risk of spread to the point where the rate of new cases becomes manageable. So that's what flattening the curve means. Social distancing, lockdown for 2 weeks, all that kind of stuff. Right now, it doesn't mean that in 2 weeks the virus will be dead and we won't have a coronavirus issue. No, we're still going to have the virus issue probably for many months to come, but we turn a catastrophic situation into a manageable situation. So really, I consider people's efforts in flattening the curve to be their social responsibility.
Yeah.
Okay, so I feel very strongly about that. So please tell your friends. It's not like most people are stuck at home now anyway. So, don't be stuck at home and then arrange for a gathering at your house because you're all bored, because that really defeats the purpose.
Right.
And I know if you've got teenagers, it's really tough. I have one, but suck it up, buttercup. Sorry.
That's perfect. That's a great way.
That's what she's been hearing. That's what my 15-year-old's been hearing. It's like, love you, babe, but you know what? You get to play pool with your old man right now because, sorry, you're not having friends around. We can't do it. Sorry.
Yeah, it's a very small sacrifice to help the burden of our healthcare system and those at high risk of developing.
Well, you're saying playing pool with me is a small sacrifice, or what? Which part of that was a small?
Maybe a little bit of both. Okay, well, thank you so much for taking time today to share some updates from PRMA and some tips on keeping safe and keeping others safe. So we'll check back in again soon.
Yeah, we're all going to get through this, guys. I promise. Yeah. We'll get through it.
Absolutely. All right. Thanks, Dr. C.
You're welcome.